So it is important for us. I need to remind you again, cervical cancer is not just treatable. That's why we are not talking about the treatment now. We are talking about the prevention, because it is the first preventable cancer in the world, and I think up until now can be done effectively. So um, yeah, so this is a very nice diagram from WHO being presented, anywhere. We have many opportunity, right, in order for us to reach the goal of the WHO goal of the world free of cancer. So we have the first pillar that we are talking about on the global strategy. I will talk about the vaccination later on, what's happening now in Malaysia, and this is a big part of the points today, for you for us in primary care to know, to understand and to implement actually seriously the cervical screening as a secondary prevention. Sorry. So um, again, it is cervical cancer is a preventable cancer. So in Malaysia, I will start with to talk about screening. Actually, we need to understand that even though Pap smear had been introduced in Malaysia even as early as 1969, and in 1991 actually started to be the like a program, but it's still, if you see the history, is still an opportunistic a program or opportunistic methods of screening. So we don't have force or compulsory test like in other countries. So that's why even though we started as the same as Australia in 1991, but Australia already have estimated time. They just waited for a few patient that still alive for them to declare themselves as free of cervical cancer. They have almost nil new cases from their own population. So but in Malaysia we don't achieve that. So because of we still opportunistic, and the uptake is very low because we don't do the compulsory, or we can do like rules, like law on Pap smear previously. Um, of course, the even in one of the national health mobility survey, the Pap smear coverage as low as 12.8% of eligible women. So it's very low, and we cannot achieve the prevention of cervical cancer, or the success of cervical screening with this very low rate of cervical smear or Pap smear uptake. So that's our problem. Talking about Pap smear or cytology, actually it is a very good test. All right, that's why, because there are countries that already achieve, even before the implementation of HPV DNA test, they achieve very much reduction in cervical cancer, much reduction in CIN. But the problem of Pap smear, the sensitivity is very, I mean, not to say very, it's not that high, it's not adequately high. Means it's not sensitive. 50% sensitive means we miss majority of high grade CIN lesion, because our aim is to detect CIN. So we miss majority of it. So that's why it need to be repeated regularly. All right, so you may miss this time this year, so next year you pick up. So that's the problem of that, even though actually it's a very specific. So it's not that sensitive, but the specificity is high. It's higher even than HPV DNA test. Means if you get what is the meaning of high what you call specificity, means if you get positive Pap smear like high SEAL, high grade squamous intraepithelial lesion as the report, it is most likely that actually you have CIN2 or CIN3 or even higher, maybe early cancer. Means it's very specific. If you get that, then you catch and straight away refer. All right. But in order to get that, you miss many times actually. You may miss because of the sensitivity is not that high. And talking about cost, okay, many maybe not agree with this what you call statement that pap smear is extremely costly, because we just we just calculate the price of one pap smear, okay, maybe about 80 ringgit or 100 ringgit in GP, compared to the test of HPV DNA test, maybe about 180 or even 250, depending on which variant, whether it include low risk in the report. But you're talking about, that's only one price of pap smear. You are not talking about human resource. You are not talking about the quality control and accreditation of the lab. You are not talking about monitoring system, and it need to be done repeatedly. So you're not talking about the what you call that, the registry, the record. All right. So actually, if you calculate all that, that's why now KKM already moved from cytology to HPV, because actually it's cheaper to do HPV DNA test. You're talking about a holistic and the whole thing. All right. So pap smear actually is more costly. All right, and in terms of acceptance, all right. Imagine, in order for you to achieve a good screening in a woman, they need at least 15 times of pap smear or you need to remember, pap smear means speculum and pap smear, about 15 times per life. So whether it is acceptable or not. Okay. And a problem, this is a real observation by one of my mentor, Prof. Win Ling in UM, in which she compared those patient with positive cytology, positive negative cytology. So means she observed all her colposcopy and biopsy patients. So you're talking about abnormal means CIN2 or CIN3, you're talking about CIN2 plus, means CIN2, 3, and also cancer. 7 in all her patient, all right, because she had a patient, she do colposcopy, the referral colposcopy for patient with HPV positive, right? She got all the referrals. So from her observation, she got about 70, she got, okay, from all the CIN, you're talking about CIN, so this is a CIN confirmed by biopsy, all right? Among them, you're talking about cytology, 52% had normal pap smear, NILM. So even though normal pap smear, okay, from her cases, more than actually among her patients, CIN2 and CIN3, only 48% have abnormal in pap smear. All right. So that's why this is very important. So even colposcopy, this is another thing. Even colposcopy, she is a trainer. She's a certified colposcopist, a renowned gynae-oncologist. Even her doing a colposcopy, she missed about 24%. She took biopsy because this is a study, but even with colposcopy naked eye, when she said this is normal colposcopy, so from the her normal colposcopy actually comprised about 24% of all her CIN. All right, mean from all cases of her CIN2 and CIN3, she only detect by her colposcopy report 70% of the cases. But because of she took biopsy for all the patient, a small biopsy for all patient, because of she want to see and observe her cases, to get the cases. So that's why the performance of cytology, talking about a single test, is not really good. All right. So that's why many studies nowadays is established facts, and not based on studies anymore. The effectiveness of HPV compared to pap smear in replacing as a method of primary screening. So it had been even adopted by WHO. You're talking about WHO. I mean, WHO is looking at the whole world. They are not only looking at the developed country. WHO looking more actually at the low and middle income countries. So it had been there in the guideline already that HPV DNA test should replace pap smear as a primary cervical screening methods. So the good thing about HPV DNA test actually is the negative predictive value. Means if you have negative HPV result, your likelihood to get CIN2 or CIN3 lesion or even cancer is very, very low. You're talking about the next 5 years. It's a very, very low compared to if you have negative pap smear. Okay, so this is important for us to explain. Okay, previously we need this to explain to patients, to explain to the to the administrator that okay, it's better. That's why we should invest in HPV. But nowadays it is not important anymore because pap smear is actually memang more costly, right? More expensive. So it's quite easier to cover. That's why you can convince the government to take HPV DNA test. So as you in clinic in GP for example, even easier to counsel the patient. So the easiest way is if you say to the patient, okay, if you get negative HPV DNA test, you don't need the test for 5 years or even up to 10 years by study. So some country even develop 10 years, and our Malaysia CPG the FMS punya CPG for cervical screening actually had made it to 10 years. So we're talking about all, talking about general, at least 10 years is enough. But you are maybe in GP, you're talking about personalized patient, they can they may be worried about 10 years. Betul ke doktor ni 10 years lama sangat, nanti saya lupa terus. You may make it at 5 years in as a your but not beyond that, not less than 5 years is actually you are not being honest. All right, so talking about if you get negative, you counsel patient, you get negative, then no need to do any pap smear or any HPV test in 5 years compared to pap smear. All right, if you're negative, then next year you need to repeat. So that's why talking about that, the patient can understand. Same goes to kalau kita counsel patient on Implanon, for example. Oh, harga satu test memang mahal, but you're talking about Implanon for 3 years, and compared to COCP, for example, for every day, every month you need to buy one pack, and now talking about Depo, you need to inject every 2 or 3 months. So actually the cost is cheaper with the Implanon. That's another example lah. Okay, you don't just tengok the price, only one price, but you tengok the whole thing. So this is the guideline that I mentioned, the primary guideline for primary HPV testing in Malaysia. We changed from it is advisable now to change from pap smear as a primary test to HPV DNA test. And even before that, actually WHO had come with the recommendation and guidelines. And actually, many of us were not aware of these action plans that had been developed by KKM during the COVID time. Is the because we want to respond to the call of action of WHO to eliminate cervical cancer in 2030. So we made, the KKM had come with the own strategy or plan from 2021 to 2030 for cervical cancer. If you see at the so just a few comments. This is quite controversial, I would say. I have presented before this time and I commented, and okay, maybe ada orang tak puas hati ke apa, but but this is kita benda yang kita kena tegur. So those of you tengok dekat participant pun ada specialist. Those of you in the that position, by now maybe I have been aware, because this is actually outlined by yourself, by KKM itself, that we should ensure affordable, equitable access to screening and treatment. Okay, so kena ada structure that can be implemented, and sustainability, etc. But the maybe this is slightly previous than this, but actually need to be tegur juga lah. Maybe akan ada orang yang repeat, sebarkan this poster. Kita nak, we want to make sure that we are successful to get the coverage of what we call that screening. Okay, tapi kita letak dekat situ faktor risiko. Okay, satu, the faktor risiko ada yang salah, which is the sejarah keluarga dan keturunan. Okay, kita kena tegur that this is not really, kalau nak pun you're talking about 0.01% of the cervical cancer, the rare cancer type, but it is not really significant. So it should be, even we teach the undergrad students, we have not say remove, actually he had not been there from the beginning. Genetic and family history of cervical cancer as part of the risk factor, tu satu. Another thing is, when you put the not to say the stigma, this is a sexual this is the sexual risk factor in which, you know, multiple, of course it is a risk factor, documented risk I mean multiple partners, early onset and all that, but it makes it can cause like a stigma and also a negative impression towards the program itself. Okay, even this is reported. I think Prof Wu had wrote a letter before to the ministry in which in one of the KK the poster for a HPV DNA test dekat situ dia tulis the risk factor, jika anda senaraikan disease dan sila lakukan HPV DNA test. Do you think, you know, women will come forward and do the test? So that's a problem. Dia letak kat situ, you know, multiple sexual partner, smoking, blah blah blah. Of course, you know, you put a barrier to the screening, in which actually the recommendation is for us to achieve 90% at least 70% of the screening. Okay, for the 90 tu kan, right? So it should be removed, and it is not it doesn't include the highest risk factor. Okay, in which now the biggest risk factor for getting cervical cancer is actually not being screened at all. So you should put there the first, you know, the first thing. So golongan yang paling berisiko menghadapi, you buat macam ni di poster kan, golongan yang paling berisiko menghadapi kanser cervix adalah mereka yang tidak pernah menjalani ujian saringan. Right, tak pernah buat pap smear or HPV test. Then baru orang tahu, oh okay, then you know, if I'm not into the program, I may be the highest, my highest is to get cervical cancer. Okay. Of course, tanda you can but actually the most important, you need to mention that early cervical cancer is not asymptomatic. Even CIN, you should really highlight the CIN is asymptomatic. So that's the importance of screening. Alright. Nanti dia kata, oh saya tak ada apa-apa, saya sihat je, buat apa nak buat pap smear and HPV. That's what you call that, an old and wrong understanding. Then it's quite common among our population, and of course it is very sad. Sedih lah kalau even from the health practitioners and the doctors, nurses, even di kalangan mereka dengan kita pun, kalau ada that perception, oh okay, tak ada apa-apa, bleeding, menses semua okay, so tak payah buat pap smear or HPV test. Kalau ada that, I think you should be very sad, and we will fail actually the aim, the target. So how frequent to do the HPV DNA test? I think in our guideline, in this guideline, it mentioned at least twice in the lifetime. But it mentioned that this is the, what you call that, the best that we should aim actually is interval every 5 years. For those who negative lah, if you're positive, you refer, right? I mean, you do for colposcopy. But the time frame from when to do is from the age of 30 to 49. Why is after 30? Because now it is still advised women less than 30. It's not advisable for HPV DNA test. The reason being, okay, that less than 30 years old, you will get very common HPV. You know, you will get many positive result. But not to say not important, actually, because of the age, because of the good immunity in this young woman, a majority of those infection or HPV infection will be cleared within 2 years. So that's why we said you don't do, because actually it's just infection that doesn't cause problem. Okay, it doesn't cause the CIN, because majority will be cleared by the immunity by the body. So why is it common less than 30? Because of the less maturity of the cervix, of the epithelium. So you need to understand the embryology, the histology, in order for you to understand that actually, you know, for very young, we are not this is not recommended to do, because you will get many positive, and then you go for the thing, but majority of those positive actually will kill. That's why we wait until more than 30. So above 30, the likelihood of the woman to eradicate the virus by themselves will reduce slowly by time. So that's why we don't do less than. So less than, those who are, actually had been sexually active, okay, the parents woman, even though less than 30 years old, then you should advise for pap smear rather than HPV DNA test. Okay. How often, it's not really, it depends on, very much depend on your affordability, okay, your cost, etc. So the government or the KKM had their own based on, it will change, all right, and the decision is just because of the collective what you call that, the cost, the budget, and all. But if you are in GP, I think, you should give option to the patient, all right, if they can afford it. Actually, the maximum is every 5 years, okay, but at least, all right, I will think the limited one is actually, that's the least that we can offer, in which, every 10 years. So it's about maybe 2 atau 3 kali, right? 30, at the age of 30, 40, and maybe the last one at before, or at the age of 50, or at least twice. Also okay, talking about WHO, at least twice, 35, 45. Okay, as simple as that. I mean, it can be incorporated to all countries actually, especially in the limited resource one. Okay, but in Malaysia, we're talking, if you start at 30, because in Malaysia, I think majority have started family, or have started sexual and also childbearing by the age of 30. So I think we can start at 30 rather than 35. So it will maybe 3 times in a woman. Okay. Of course, how to take sample, I think it's there in the guideline. By time now, you already know there are many videos. All right, it's quite simple, easy to do. They can do. This is talking about self-sampling. Of course, HPV DNA test can be performed, can be done together with pap smear. You know that by now. In the LBC, using liquid-based cytology. Okay, you do pap smear, and together with HPV test, they will use the fluid also to test for the DNA. But it needs speculum and all that lah. So it happen to be you are doing speculum for other reason, okay, for a gynae problem, for example, and they tak pernah buat lagi. So you can offer for you in dalam you alalang you buat speculum, then you either you take the H swab for HPV, or you do the co-test, the because some lab actually had, it's quite a good discounted price if you do the LBC, the smear plus the HPV DNA test, all right, or we call it co-test. And the good thing about co-test, it can check for other STD like chlamydia. Okay, so that's a good thing about taking LBC also. But for those women asymptomatic, no problem, no reason for you to do a speculum. Okay, HPV self-testing is a good option. All right, and for me, in my opinion, it should be available in all primary care setting. Okay, in all the, of course, in KK slowly they will incorporate into all KKs, by phases. But in GPs, you should search for lab that can do HPV self testing. Is there in the guidelines from Nation CPG, but videos pun ada, right, to how to do the test.